Hi guys, I'm Dr. Munshi. I choose this topic because day to day different types of uh, scientific research evolving. Nowadays we know that COVID-19 is airborne, and due to that and due to different other causes, second wave again came, and it is now devastating in India and different other countries also. Now we have to take the preventive measures very strictly, and there are some new studies that found how to use efficient mask. I just selected 4 or 5 slides for that. Just watch the complete video. A US CDC study concludes that double masking with a cloth mask on the top of a medical grade mask can substantially reduce the wearer's exposure to COVID-19. So now you have to, the concept arises double masking. Now how to double mask, how to use double mask efficiently, I'll discuss in subsequent slides. One of the way of masking efficiently, that is by single mask only, you, you have to tie a knot. You have to tie a knot. You can see in this slide, I think you have to tie this knot and it will fit properly. Second, that is more efficient, that is double masking. Now regarding double masking, I will discuss in elaborate way in subsequent slide. Now this is regarding the knot. Tie the ear loops close to the edges of the mask and tuck in the side plates to minimize gaps. So this technique will minimize gaps and this will fit properly over your face. So this is the concept if you using one mask. Now second, double masking. Wearing two masks could make it more difficult to breathe, but double masking with a surgical and a cloth is generally well tolerated and doesn't reduce oxygen supply. So if you think that double masking will reduce oxygen supply, it is clearly said, it is clearly evident that on top of a surgical mask, wearing a cloth mask will not disturb oxygen supply, it not doesn't reduce oxygen supply. So you have to wear like this. Next, studies about how efficient the masking. You can see from the slide, an unknotted surgical mask blocks 56.1%, a cloth mask 51.4%. Now knotting, that I discussed earlier, 77%. A knot and tucked surgical mask blocks 77% and double masking 85.4%. So this is the best way. If you have one mask, then you have to wear like this, knot and tucked surgical masks. And if you have two masks, one surgical, one cloth, then this is the efficient way of double masking. Okay. Now, what are wrong concepts about double masking? Surgical over surgical is wrong. Cloth mask over cloth mask is wrong. N95 plus any other mask. Adding two masks, one is N95 and plus other mask is wrong. If you are using N95 mask, then use only N95. No other masks needed. But if you are using surgical masks or cloth mask, don't put the same type of masks over the same type of mask. That means no surgical plus surgical, no cloth plus cloth. So what is the efficient way? Always pair a surgical and cloth mask for double masking. How to pairing it up? Always pair a surgical mask and a cloth mask for double masking. So these were the preventive measures. You have to take it strictly nowadays, and these things will break the chain of infection spreading.